Good morning, and welcome to the 6th Annual Hunger and Health Panel discussion presented by Gleaners Food Bank of Indiana and the Indianapolis Business Journal. I'm Nate Feltman, publisher of the IBJ and CEO of IBJ Media. Thank you all for joining us this morning, bright and early on a Monday morning. Before we begin this morning's program, I'd invite you to check in and let us know you're here. On your table and programs, you'll find a QR code. You guys are used to the QR codes. We're all used to those now. Use your phone to scan the code, and you'll see information on this morning's program. Learn about upcoming events and sign up for our free daily news updates like 8 at 8. You can also, most importantly, submit questions this morning to our panelists, and you can actually begin doing that immediately. So please do scan and check in. We also have a special discount subscription offer exclusive for today for all of you for our business news subscription combo, which gives you access to the Indianapolis Business Journal and our statewide platform, Inside Indiana Business. I want to thank Gleaners President and CEO, newly installed President and CEO Fred Glass, and the entire Gleaners organization for their ongoing partnership with IBJ Media. It's a privilege to work with all of you in the fight against hunger. I know many of you here today are deeply involved in the work to ensure all of our neighbors have access to food. Despite all of the hard work by so many, food insecurity is all too real for too many Hoosiers. Gleaners is leading the charge to fight food insecurity, and more Hoosiers than ever count on Gleaners and thousands of volunteers to sustain them. Today, as most of you know in the room, Gleaners is one of the largest food banks in America, distributing nearly 100 million meals per year to 300,000 hungry Hoosiers across 21 counties in central and southeastern Indiana. That's over 4% of Indiana's population that Gleaners is touching every year, an amazing statistic. With over 100 employees and more than 12,000 volunteers donating almost 60,000 hours per year, Gleaners supports over 300 local food pantries, schools, soup kitchens, and community centers. Thank you again for joining Gleaners and IBJ in the fight against hunger, and thank you for your compassion, your commitment, and for all you do to help your fellow Hoosiers. I know we will all walk away from this morning's dialogue more informed of the challenges in our community, while as a state, as you know, Indiana has made great progress on many metrics. We have struggled to improve health outcomes for Hoosiers. We know that to the extent Hoosiers' nutritional needs are not being met, our health outcomes will continue to be poor, in turn affecting educational outcomes and ultimately economic outcomes. After breakfast, we will dive into these important topics with our remarkable panel, which will be moderated by IBJ Media's Inside Indiana Business President, Gary Dick. Before getting our own nutrition this morning, it is my pleasure to introduce a friend and new Gleaners President and CEO, Fred Glass. Most are well aware of Fred's remarkable career. He graduated from Indiana University and attended IU McKinney Law School, something we both share in common. Fred served as Chief of Staff to Governor Evan Bayh and then practiced law as a partner at Baker & Daniels, now Faegre Drinker, and served as President of the Marion County Capital Improvement Board. Fred then accepted the challenge to serve as Vice President and Athletic Director at his beloved IU, and served in that capacity for 12 years before returning to the practice of law at Taft. You can understand why accepting the opportunity to lead Gleaners was a natural for Fred if you read his new book entitled Making Your Own Luck, From Skid Row Bar to Rebuilding Indiana University Athletics. Among other things, Fred writes movingly about his father's efforts to feed the hungry at his Skid Row bar, including Fred and his family having the Christmas, Easter, and Thanksgiving dinners at the bar, so the patrons with nowhere else to go would have a place to gather and enjoy a holiday meal. Thank you, Fred, for your continued partnership and all that you and your staff do every day to lead the fight against hunger throughout the state. Please welcome Fred Glass.
Good morning, everyone.
Good morning.
Thank you so much for coming out fairly early this morning. It's Much appreciated. I'm told this is the largest crowd we've ever had for one of our IBJ Hunger and Health breakfasts. So thank you for helping make history and being with us today. I'm very, very excited to be here, figuratively here, as the new CEO and president of Gleaners Food Bank. It's a great honor, and I think it'll be the honor of my professional career. And also, I'm very excited to be here literally with all of you and so many friends and so many new folks that I'm yet to meet. So I look forward to continuing with you. It's been a long journey here to this day. I was practicing law after I'd been at IU and happy doing so. But when the Gleaners opportunity arose, I embraced it and pursued it with vigor. And people ask me why, and it's about the mission. It's about feeding the hungry. We're not called to do that many things, but we're called to feed the hungry, clothe the naked, welcome the stranger, visit the prisoner, visit the sick. And when you get a chance to do one of those big things, and I would submit to you that maybe the most fundamental of those is feeding the hungry, it's a great honor, and I'm thrilled that the board chose to give me that opportunity. As Nate referred to, it really does feel like coming full circle. My dad never talked about the gospel, but he lived the gospel, and we did have those meals at the tavern. And my mom should have known what she was getting into. Later in their marriage, I heard the story where at their honeymoon, mom and dad were there at Clifty Falls State Park, and my mother came home after being out for the day and found a third place set at their honeymoon table. And she was like, "What's that all about?" And Dad had struck up a connection with the cold delivery guy who was cold and hungry and had a long day, and Dad invited them to their table. And that always stuck with me. So I do feel like I've come full circle, and I'd like to think that Dad would be proud about where I've ended up. I'll say it's not lost on me that it's a little silly that in my first month as CEO, I'm speaking at the keynote address to a bunch of people that probably know a lot more and certainly have a lot more experience with the fight against hunger than I do. But I hope that these introductory remarks, focusing on my first month as CEO of Gleaners, which is almost done, can be helpful in framing the issues that we are going to talk about this morning. The relationship between hunger and health, how food equity impacts health equity, and that the time for creative intervention is now. I've been asked, what are my plans? What's my vision? And I unapologetically say, I really don't have one. I am focusing on listening and feel like I've been on a listening tour since I've come to Gleaners. Much to John Elliott's chagrin, I would refer to my first month in September before I actually became CEO as a time when I was the junior varsity CEO. I didn't have the responsibility of really doing anything, but I was there, and I decided to use that time to really listen to the folks that I felt like I needed to listen to. We have 28 board members. I spent extended time having conversations with each and every one of them. We have 105 employees. I was able to personally meet with each one of our employees. I volunteered in the Gleaners Pantry for a day, which was a great experience. And maybe most meaningful of all, I was able to visit all 21 counties in our service area. And when I told Kathy Hahn-Kiner who leads that effort, that I wanted to visit all 21 counties and the pantries therein, or at least a couple in each one. I think her head was going to spin off because that was a pretty ambitious endeavor, but thanks to her good work, we did accomplish that. I visited the last one in Putnam County on the 30th of September, which was great. And even though I knew intellectually about hunger, about the people that feed the hungry, about our neighbors who are in need, it was a really impactful visit. I remember when I was in Franklin at the Interchurch Food Pantry, sadly this father with a van full of kids ran out of gas in line, waiting in line to receive food, and the look on those kids' faces and sort of the embarrassment as things got scrambled to kind of push them out of line reminded me of something my dad always said, that poor people have poor ways. And a great metaphor maybe for like living on the edge, that they didn't quite get to the pantry because they ran out of gas. And Susan Klutz, who's an awesome volunteer pantry manager there, told me that that's not an infrequent occasion, that people run out of gas in their line quite a bit. I was in Evansville, or in Martinsville, at the Churches and Mission Pantry, and Linda Hadley, who's the pantry manager there, told me a story about a woman who pulled in and had a nice car, nice clothes, had a manila file folder full of old utility receipts and her birth certificate and her social security card, and she was wanting to show it to whoever she needed to be. Obviously her first time at the pantry, and the pantry manager literally wrapped his arms around her and said, "Honey, you don't need to prove anything to us. You're welcome here." Her husband had lost his job and had subsequently left her with 4 children, and she found herself needing those services in Martinsville. I mentioned my last stop in Putnam County, and Brandy Dixon is a teacher there, an amazing woman who found out that Putnam County was the only county in our service district that didn't have a school-based pantry, and she wanted to rectify that and started it with her kids, her students, and they embraced it and did everything in it, and actually gained some work experience, Nate, that they could put on their resumes to pursue other jobs. And then she told me that after the pantry closed, about a half hour later, some of the kids would come in and said, I was too embarrassed to share this with my classmates, but my family's in need, and would it be possible for me to bring some food from the pantry? Rosemary was, when I was working at our pantry at Gleaners, my favorite part was helping carry groceries out to the cars, because the people would start talking to you then and helping load the cars. And Rosemary, and I remember her name because that's my mother's name, elderly woman walking with a cane. It was very important for her to tell me that she only comes once a month, because she said, I can get by if I can come by once a month, and I don't want to take food from somebody else who needs it more, which is very typical of our neighbors. They're not happy to be in need. They don't want to take more than they need, and Rosemary will always be sort of embedded in my mind. The most impactful interaction I had was at the Gateway Hunger Relief Center in Richmond, where I met Christina, who told me that she had found herself in need of services because her house had burnt down, and she was in line, and much like our friend in Martinsville, Christina was crying, and the head pantry person just put his arms around her and said, "Honey, you're welcome here. There's no judgment, And by the time she made her way through the front of the line, she was working at the pantry. She was bagging groceries, and she's been there for 7 years and is now the assistant manager of that pantry there. While I was there was a needlepoint sign that really captured my attention, and I was looking at it, and I was taking a picture of it because I wanted to remember it. And Shelby Jones, the assistant manager, said, "Do you like my sign?" And I go, "Yeah, I do." And she went up and she just took it off the wall and gave it to me, which was so typical of the folks that work in our pantries, right? They are give the shirt off their back people. And I took that sign, and it holds a prominent place in my office, and it says, and some of you have heard this before, "If you feed them, they will come." And the reason that was so impactful to me is, as many of you already know, and I'm starting to learn, where we are, where Gleaners is and food banks are, and many of you who are other food banks or part of the pantry, it's not a franchise by Gleaners, but it's part of what we do, is we feed people. And even though the need keeps changing, the goalposts keep moving, we're pretty good at feeding people. And that's our core competency, to feed people, and that's vitally important. But the most exciting thing about feeding people is if you feed them, they will come, and then you can help them with other services that put them in a position of being hungry in the first place. They come for the food, but they may stay for the health screening at Eskenazi. They come for the food, but they may stay to get signed up for government programs that they otherwise weren't aware of. They come for the food, but they may stay to get utility relief or transportation assistance or job training. And so I believe one of the things we can do is to feed them, but also to set the table for wraparound services that come from community-based, local, neighborhood, closer to the people, the better, because they may not know or trust Gleaners, but they may trust their local church, their community center, the people they know in their neighborhoods. So it's an old saw, but it takes more than feeding the hungry to beat hunger, and it's critical for us to do both. Thankfully, the connections between hunger and health, and between food equity and health equity, are increasingly receiving the national attention that they deserve. Just last Tuesday, again, this is in my first month as CEO, I was honored to represent Gleaners as one of just 5 of the 371 food banks in the country. We were one of just 5 invited to participate in the USDA's National Nutrition Security and Healthcare Summit in Washington, D.C., which was important, as underscored by it was also attended by the secretaries of USDA and Health and Human Services, among many other national leaders throughout the country. The summit was an encouraging and inspiring follow-up to the groundbreaking White House Conference on Hunger, Nutrition, and Health that was just a month before, where Gleaners had also been represented, that time by my outstanding predecessor as CEO, John Elliott, who is back from his post-retirement trip to Madagascar. And John, it's awful kind of you to be here today, and we all appreciate it, and I personally appreciate it. The summit was an important and exciting opportunity to bring together not only a wide array of healthcare sector experts, but also anti-hunger organizations like Gleaners to address how we as a nation can work collaboratively to pursue nutrition security, aptly defined by the USDA as ensuring all Americans have consistent and equitable access to healthy, safe, and affordable foods essential to optimal health and well-being. In essence, the purpose of the summit was to start to operationalize the 5 pillars of the national strategy established by the White House Conference. Number 1, improve food access and affordability. Number 2, integrate nutrition and health. Number 3, empower all consumers to make and have access to healthy choices. Number 4, support physical activity for all. And 5, enhance nutrition and food security research. Our challenges are clear and they're chilling. As reported at the White House Conference and USD Summit, poor nutrition is a leading cause of illness in the United States, associated with more than 500,000 deaths per year. The toll of hungry and diet-related diseases are not distributed equally. Such challenges disproportionately impact communities of color, people living in rural areas, people with disabilities, older adults, LGBTQI+ people, military families, and veterans. For example, rates of obesity and type 2 diabetes are rising among children, and recent estimates project that most children in America today will have obesity by the time they are 35 years old. Let me repeat that last one and let it sink in just a little bit. Recent studies project that most children in America today will have obesity by the time they are 35 years old. In 2021, about 10.2% of American households experienced food insecurity, with significantly higher rates among Black households, nearly double the national average at 19.8%, Hispanic households 16.2%, households with children 12.5%, and households with incomes below 185% of the poverty threshold, 26.5%. And it's worse here. According to the Indie Hunger Network, 13.5% of Hoosiers are food insecure, and for Marion County, it's 21%. U.S. News and World Report ranks Indiana 40th among the 50 states in public health. Feeding America estimates that food insecurity adds $1.8 billion to healthcare costs just here in Indiana. According to Fairbanks School of Public Health at IUPUI, in 2018, the life expectancy in Center Township was 68 years old, compared to 84.8 years just up the road in Fishers. Congressman James McGovern of Maryland said it well at the summit. The color of your skin, the size of your pocketbook, and the location of your zip code should not determine how long you are on this earth. Like with many of you, these broader trends continue to hit home with Gleaners. Demand for our food assistance remains extraordinarily high. Our overall distribution is up 50% from the beginnings of the year across all agencies, counties, and programs. This level of distribution is twice that of before the pandemic and 85% of the pandemic highs. Of course, at some locations, the demand increase is even higher, such as our mobile pantry at the John Marshall High School, which is now serving more than twice the families that we did during the pandemic, or earlier this year, sorry. For too many families, the economic crisis created by pandemic, combined with the recent rise of inflation and related fallout, especially with the sunsetting of national programs that were in existence during the pandemic era that are ending now, have made it impossible to provide for the most basic needs, including food. Exacerbating the crisis of substantial increased need is a reduction in and the related increased costs of food. In 2020 and 2021, USDA food donations were 20 million pounds. In 2022, USD food donations were 10 million pounds. In 2023, we expect USD donations to be 6 million pounds. Feeding America projects a 2 billion pound deficit in charitable food nationally including a further 27% reduction in USDA donations and a 22% reduction in food purchasing power as a result of inflation. So, the challenges are great and the stakes could not be higher. We must have and will push for the kind of national support that was identified and advocated for at last week's summit. But we can't and won't wait for it. Working together as trusted community partners and great teammates with the neighbors we serve, our pantry partners, our sister food banks, healthcare organizations, government, business, schools, food sourcing partners, community groups and other non-for-profits, the Indy Hunger Network, Indianapolis Community Food Access Coalition, Feeding Indiana's Hungry, Feeding America, and other anti-hunger organizations. Our generous donors and our committed volunteers, we will tirelessly work not only to feed the hungry, but to end hunger. Thanks for being here today.
Thank you, Fred, and thank you for taking on this new, incredibly important assignment in the fight against hunger throughout our state and our communities. We know that with your leadership, we'll begin to make significant progress. We will return shortly with Gary Dick and our panel discussion, so please enjoy breakfast and networking, and then we'll be back with you. Thank you.
Our partnership with Gleaners allows us to feed way more families. Our estimate this year is 25,000 families, which equals 105,000 people.
Good morning again, everyone. My name is Gary Dick. I'm the host of Inside Indiana Business, also the president of the Inside Indiana Business Division of IBJ Media, and it gives me a great deal of pleasure to serve as your MC for what I know is going to be a great panel discussion this morning. Thank you all for being here this morning to support Gleaners and so many of the organizations that are represented in the room today in the fight against food insecurity, a very real issue and one that impacts our economy and our community in so many ways. We saw the demand during the pandemic, I think essentially double, perhaps more, in terms of demand on the resources and the services at Gleaners and other organizations. Now we see what's happening with the economy and inflation and things going on in that regard that put further pressure on the services to fight food insecurity. So this is it has been a real issue for a very long time, even more so today. And we're going to get right to some of the dynamics and what we're seeing around the Indianapolis region, perhaps around the state as well, with a great panel this morning. And briefly, I will introduce our panelists, who are Malaley Kennedy. Malaley is the director of the Division of Community Nutrition and Food Policy at the City of Indianapolis. Dr. Lisa Harris is the Chief Executive Officer at Eskenazi Health. Also, Dr. Cami Wright is Vice President and Market Chief Medical Officer at CareSource. And Naima Gardner-Rice is SNAP Ed and Nutrition Programs Director for the Indiana Department of Health. Welcome, one and all. And thanks for all you do in the fight against food security. Fred mentioned challenges are great, stakes could not be higher. And I think that was a very appropriate statement to make. Given that, I would be interested in each of your takes, if you will, on the fight against food security, what you're seeing out there today, maybe what's keeping you up at night, kind of your view of the market.
What's keeping me up at night is the fact that as much as we've been able to provide to our neighbors, to our residents, our community, there is still so much need. We are seeing just this disproportionate amount of need in our Black and brown communities and in our pockets of food insecurity that we have just not been able to get to. And so that says to me, oh, we need to do something different. We need to look at things differently and figure out how we meet the needs of those that are most vulnerable.
You mentioned black and brown communities, and the statistic that among many that really jumps out, black children more than 3 times as likely to face hunger than white children. Why is that? What are the dynamics that make that an unfortunate reality?
Well, the fact is that hunger is just a byproduct of all of the other disparities that families are facing. And while we can help families to get food on their table, we are looking at one meal at a time. And those meals need to be nutritious. We need to think about nutrition security as opposed to food security. And really, what else do those families need beyond just that one meal? How do we ensure that they're getting the proper health care that they need? All of the other needs that make that family safe and secure in their home. And until we figure that out, we're going to see those numbers because we're just not stepping up our game to where we are getting to the root cause of what those families need. And when we do that, that's when we'll see those numbers improve.
Lisa Eskenazi is involved with so many initiatives, not only here in central Indiana, but I think touching every county in the state of Indiana. What are you seeing in terms of demand and some of the dynamics out in the marketplace right now?
Oh my goodness. I'm going to color in a little bit of what Malele said first in terms of the extent of the problem. And, as a system, we exist, Eskenazi Health exists to promote health equity. That's where we had our origins, back at City Hospital. People with money were cared for in their homes by private physicians. The folks who didn't were cared for in tents until City Hospital. And, so that's really why we're here. And we have, we decide where to put our next health center by where the folks are who need us. And yet, here we are over 150 years later in the wake of the most recent pandemic, and we see that, as Malele said, we are really, I would say, struggling to gain ground. We see demand across all of our sites of care. We recognize that back in we've started these programs a long time ago with a pantry at our Crooked Creek Community Health Center, where that was in 2015, where we recognize our Deanna Reynoso and the physicians providing care there recognized the foundational importance of nutrition and how poor nutrition was compromising their ability to provide care. We know, as Fred mentioned, that so much the burden of chronic disease that particularly overburdens low-income populations, most of that can be prevented or better managed, in some cases even reversed by good nutrition. So they recognized that and started a pantry, started screening, individuals, but that the screening didn't really take off until there was something that we could do there, and that was in partnership with Crooked Creek community, the Crooked Creek Neighborhood Association, St. Luke's United Methodist Church, Dow Agro, many partners, Gleaners, now Elevance, really focusing on bringing everything to bear. We have 160 volunteers out there. And talking about feed them and they will come, the demand for food is actually, to some extent, overwhelming the capacity of the site to provide health care. And so, I don't want to talk about all our initiatives. I can talk about those as our morning progresses. But we've seen just, since the end of the federal relief that doubled the benefits, or increased the benefits to low-income individuals for food. We saw that, and the inflation hit at exactly the same time, and we've over the summer, month after month, doubling. So in 2015, we served 5,000 households, and now it's over 40,000 households. So I will wait and see how the morning progresses to decide how we talk about some of the other things that we're doing. But it started there and has expanded now to a market on the campus that's expanding as a mobile market, and we can get into some of that if there's time.
Yep. Cami, what are you seeing at CareSource? I know you're a big proponent of taking a holistic approach to this fight and not individualized, if you will. What are you seeing?
So I'll tell you what keeps me up at night, and it is the fact that while so many things are getting better for many of us, since the pandemic has died down and the world is opening up and we're able to enjoy things, things are actually getting worse for many parts of our community. We are seeing less, as you stated, government aid for individuals, so less resources. We are seeing many communities, particularly Black and brown communities, that have been devastated by the pandemic and may never recover. So jobs have been lost, family members have been lost. There's decreased access to food, grocery stores have closed, et cetera. As a managed care entity, we're seeing that reflected in gaps in care. So we're noticing that our members are not getting the necessary care that they need. Immunizations is one that I'll throw out. We're seeing immunization rates that are as low as they've ever been. And when we look at that, there are many drivers, but I think one of the biggest driver is just competing priorities. If families are concerned with meeting their most basic needs, food being one of those most basic needs, then there's not the capacity and the ability to interact with the healthcare system in the way that we think that they should. So that's a disturbing trend that I'm seeing, and I think that entities like mine need to recognize that we really have to sustain people in the most basic way before we can ever hope to see better engagement and better health outcomes.
Yeah. Naima, access to nutrition programs obviously is a huge issue, and increasing access to those programs. I was talking before the event this morning, and someone made the point of a huge, like 75% of those who qualify for SNAP benefits really don't access the system. Talk about that access issue and what you're seeing now.
Yeah, so to bring sort of a public health framing to this, access is something that we're really interested in understanding. And Malele earlier mentioned the phrase root cause. You know, we really want to understand the root cause of some of these inequities. And I'll offer an additional term that's similar. Public health practitioners in the room will be familiar with this, but it's the phenomenon of upstream causes, right? When you think about the continuum of health outcomes throughout the lifespan, we look at upstream versus downstream. Hunger is a downstream output of a lot of things that are happening upstream. And I think to sort of tie this all together, it really is important to pause for a moment on this question of why. You know, why are there these persistent racial inequities across all systems, right? It's not just the food space where we see these types of inequities. And I think it's really important to understand, not to politicize the issue at all, but to really understand the intentionality around a lot of the policies and practices that have led to these types of outcomes. For example, if you want to just in our work, we talk a lot about the phenomenon of redlining, which is essentially the systematic disinvestment over generations within Black and brown communities. Those
types of policy decisions have very material consequences. And access is one of the main things that we see, one of the main drivers of these persistent inequities. Almost nobody experiences hunger within a vacuum. All of the panelists have spoken to this so far as well. There's also these competing priorities related to access to healthcare, access to transportation, access to decent jobs that pay a living wage. From my perspective, and what we try to do within our team at the Department of Health is understand all of these challenges through a systems lens, understanding that not only are all of these sort of independent systems incredibly complex, there's a dynamic interplay between these various systems that really needs to be understood before we can find our own access point in terms of where we want to design intervention or programmatic responses. I think we have a tendency as humans, and the medical doctors on stage will know a lot more about this than I do, but I think our brains really want to put things into very tidy compartments. We want to, Fred talked earlier about how Gleaners, they're very, very good at feeding people. And that's really important that organizations like Gleaners exist to do a very specific thing and do it well. Our responsibility, folks that are working more at the systems level on behalf of state government or healthcare entities, our responsibility is to understand how all of these complex things are working together so that we can design more creative and more holistic interventions to respond.
Can I just piggyback on that? There was something that Mr. Glass mentioned again about how if you can feed people, you can also then subsequently tack other things on to that. And I really like that concept of, people are concerned about food, obviously, but can we use that as a gateway to accomplish other important things? So I think much of what you're saying is let's decrease the silos and work together. So can we offer, I'm going to go back to immunizations at places that provide food access? Can we do brief health screenings? Can we at least provide information and education so that we're all kind of pulling in the same direction? I think that we are looking at things at a slightly different lens because of the organizations that we represent. But I think that the goal is to have the healthiest, most vibrant community possible. And I think that we really need to explore ways to come together and do that.
Lisa, you were going to.
I was intrigued. Naomi used a term that we use a lot, going upstream. And, we think of healthcare as, we're usually the catchers, we certainly are well prepared to care for people who are seriously ill and critically injured, but we know that the most important work is upstream, is beyond the walls of our hospital and our neighborhood health centers. It's in the communities. We had, in a discussion we had before this call, I liked the discussion meeting proceeding at the speed of trust, and the importance of that was your reference, the importance of working within communities and on these root causes that are so complex and intertwined. But at the heart of all is the poverty that has resulted from these inequities in wealth and opportunity. And so this is something that is, we took this, what we learned at the PCAR Health Center with the Crooked Creek Food Pantry, and saw again that when we think about a place that could be a convener of many, many, many partners. It's the healthcare setting is a place that's, patients know it, they come, it's convenient, there are resources, and so it has the possibility of serving as an anchor of the many, many partners that are required to actually make headway on these concerns. And so I have some folks here who make up the team that we've recently pulled together to focus just on what we know is what we have referred to as the social determinants of health, and creating health equity zones around 3 of our health centers, with the idea of taking what we learned there and expanding it beyond. But that is an absolute deliberate partnership, starting with what the community, acknowledges, starting with the strengths within the community, the resources that are already there, and helping to build on that. But I think as we think about all the silos, that's one way that we can bring together in a place where people are already accustomed to, coming for healthcare and needs beyond healthcare.
Good. As we continue our conversation, a reminder to take these things we can't live without, our cell phones, and scan the QR codes on your programs to submit questions, and we'll get as many of those answered as we can as we continue the conversation. The White House has stated a goal of ending food insecurity by 2030. Ambitious goal, certainly, and certainly there was a recent summit at the White House. USDA had a big conference, and Fred mentioned Gleaners are part of that, which was quite a coup because there weren't many organizations all over the country that got to participate. But a recurring theme is food as medicine. And when you talk about that, and I'll throw this open to anyone who wants to jump in because I know you can all talk about it, why is that important, and what are we seeing here in central Indiana that reflects that food as medicine theme?
So I'll just jump in and start. We know that we have very critical health disparities in the United States, and Indiana is no different. And we see it in the space of chronic diseases like diabetes and hypertension and heart disease. We see it in cancer. And then heartbreakingly, we see it in obstetrics, so maternal and infant mortality. And if we look at the drivers of a lot of those disparities, it really trickles down to meeting the basic needs. So, we've talked about quality, not quantity. So there are people who can get food, but it's food from a convenience store that maybe is not the healthiest, that's driving rates of obesity, also contributing to diabetes, to heart disease, to hypertension, et cetera. And so I think the reverse is true as well. If we could provide access to healthy nutritionist food, then we can really offset or even reverse some of these chronic conditions. So if we can really get food that actually causes people to thrive and causes their physiology to work appropriately, then we really see food acting as medicine. And I think even in the infant and maternity space, you certainly can see that proper nutrition is really important to having a healthy pregnancy. But the other thing people don't think about is toxic stress. So if you're constantly trying to make ends meet, you're constantly worried about where your next meal is going to come from and how you're going to feed your other children, et cetera, that does things to a body that can result in poor outcomes after pregnancy. So that's another place where putting really high quality food in the hands of our pregnant and new moms can really help to offset some of the negative health consequences that we're seeing here in the state.
Let me add one thing to that. So two things. First, on the more traditional food as medicine programmatic paradigm, food is incredibly powerful for a lot of reasons, but it's when you think about food as a medication, it's one of the only medications that has both preventive power and the power of acute treatment. There's a robust body of evidence that really shows that people with type 2 diabetes, hypertension, there are a lot of sort of chronic diseases related to the food that we eat that can be treated just by shifting the types of food that we eat. So that's one piece of it, is that not only is this true sort of intuitively that we know that food is important to our bodies, we have a lot of evidence that shows that prescriptive food programs really, really work from an outcome standpoint. We have a lot of programmatic work going on in the state right now. Our team just oversaw a pilot program with some CDC health disparities dollars. So we have new food as medicine programs all over the state, from the tippy top down to the very bottom, which is very, very exciting. And we're really excited about the data that we collect from these programs. We really want to put together a powerful narrative of these types of programs to advocate for more sustained, stable funding for this type of program. And the other dimension that I just want to highlight that I think is really important and is a little bit outside of the clinical space, but I think it's really important to understand that people, in addition to the physiological needs and impacts that food has on our body, people also have a lot of cultural and social needs that food meets. And I think that oftentimes is not held in as high a regard in terms of where we're allocating our programmatic dollars. But when I think about sort of what keeps me up at night, I think about the lack of sovereignty and autonomy so many people have in relation to their food choices, and how important it is to all of us, how much community we find around food, how much of our own individual social identities are tied to food. And so, today we're here talking about a lot of challenges, but there are so many joyful and wonderful things about people's food cultures, even within communities who really do struggle. So I think that's another really important aspect of food as medicine that is important to mention today.
Naima mentioned that cultural relevance, and that is so key for residents, especially in these communities that have been seeing so much disinvestment over time. Building that trust with community, ensuring that we are listening and hearing their voice, and what they need and how they need it is key. Most residents are aware of their chronic disease. Black and brown communities are certainly aware that they are more likely to have chronic disease and that they want to do better. They want to do more to make their families healthier. But it's about how we get that information to them, how we provide the services that they need in a way that is equitable, that is culturally relevant, and that's sustainable. We hear from communities so often, oh, this is just another program and then that'll be gone, or they're here right now, but they're gonna forget about us again. Yeah. So how do we ensure that our residents become a part of our solution? How do we ensure that we provide sustainable solutions to the health disparities and impacts that they are seeing every day and living every day, and recognize their reality in the solutions that we provide?
Okay.
Please.
No. Well, I think, just in case anybody's wondering, what we're talking about is food as medicine. I think we do have to shout out that means mostly a plant-based diet. It doesn't mean we all have to be vegans or even vegetarians, but it's a diet that emphasizes fruits and vegetables. Dr. Virginia Kane knows this. That's why the Marion County Public Health Department offers the Produce RX and the Fresh Bucks programs that extend the value of SNAP benefits to incentivize buying fresh produce, extend the actual $90 a month. That's real money for buying fresh produce. Gleaners knows this. I just recently joined the board, and I was very happy to hear that across the state, about 30% on average of the food that Gleaners distributed is fresh produce, and more than half of that is coming from local farmers. So I think that we need to recognize that all these programs that create that incentive. We also have extended that. Back in the 70s, we started a program with Meals on Wheels, and we've been providing food for Meals on Wheels since then, and that has evolved now to what we call medically tailored meals, so that we get even more deliberate about what the dietary composition should be based on an individual's medical needs and cultural preferences. And so that is the program you referenced that now is extending beyond central Indiana, where we deliver to homebound individuals, adult daycare centers, through the Ryan White program. That was the next extension, individuals living with AIDS across the state, and now in all of 92 counties, working to continue to increasingly tailor it to individuals' medical needs and preferences, because we know there isn't anything more powerful in our medical armamentarium. I mean, you hold the plant-based diet up against statins, for cholesterol control. There's no comparison in terms of the power to prevent heart disease, as Camille mentioned. So,
I just want to piggyback a little bit on making it culturally relevant. So we have to understand the history behind why we eat what we eat. So speaking specifically for the Black community, a lot of the food that we see as normal and comforting actually comes from back in slavery, when we had to eat scraps and we ate what was left over. And so now we eat things that really are not healthy for us. And we learned to doctor those foods up by putting a lot of seasoning on them and a lot of butter and a lot of things to make them palatable. So now that's what we see as normal. And so I think it's not enough just to give people nutritional food, but you have to also provide the education. I think education is really critical to say, this is why this food serves your body better. And here's what you do with it. You cannot show up with a bunch of eggplant and leave it on the porch and expect people to know. Expect people to know what to do with it or why they should care. So I think that, we talked about trust, which I love that word. I think we need to find thought leaders in the community who are respected, and churches and community centers and other places where people congregate, and really provide education, provide cooking classes, help people understand why it's okay to adopt a new way of eating, and how you're not turning your back on your culture or your history if you choose to eat in a different way. So I think that that's just an important point I want to make.
Good. As we talk about food as medicine, quality versus quantity, what are some of the, you mentioned Indiana farmers as a resource, an increasing resource. What are some distribution models or access points for organizations to get that quality food that's needed? Are there things being done?
I'm so glad you asked. Yeah, so I want to just take a step back for a second and just talk about, when I try to describe the work that our team does, I often use the phrase, we take a food systems approach to public health nutrition. And I think it's important to pause to make sure we have a shared understanding of what a food system is. A food system, like all systems that govern our lives, is incredibly complex, but it really comprises every point around the supply chain, from production to aggregation and processing, to distribution, to retail, to consumption, to disposal, and then hopefully sustainable regenerative types of practices. But I think what's really important to understand about a food systems approach is that, number one, at each one of those sort of complex intersections around the food system inequities are persistent within each aspect of the food system. So when you think about food production, who is growing our food, where are we getting our food? Land access is an incredibly endemic and challenging thing. There's a lot of money coming down right now from the USDA and other funding sources to really look at this process of localizing or regionalizing our food system. A lot of this is not only because of the hunger needs that arose during the pandemic, but also we all sort of collectively realized how vulnerable our supply chain was, that if we are only reliant on this very sort of obtuse and intimidating global supply chain, we're incredibly vulnerable when that supply chain is disrupted. So a lot of the work that we are doing right now within our team, and there's a lot of work going on around the state, is really understanding how we can insulate ourselves from those types of vulnerabilities by investing in local producers, and understanding from a distribution standpoint, what food do local producers need to be growing? What do communities want to procure and prepare and eat? To Cammie's point, I think that nutrition education programs, which is, that's what we do, right? At the end of the day, we, as a public health agency, we want to ensure that all people have the tools that they need to eat healthy diets. And nutrition education is a big piece of that. But nutrition education programs are only as successful as the environment surrounding them is supportive, right? So if people are educated on nourishing food choices, but then have no choice when they go to the grocery store or go to their, then it really is not helpful to them. And I think, I'm sort of getting myself down a rabbit hole here, so I apologize, but I think that one of the things that is sort of maddening about this work, and when we look at the really grim data, is that many of us have been, investing ourselves into these types of careers for decades, and we've seen very little movement in terms of chronic disease falling. People are not making better food choices, right? So the question is why? Why after billions upon billions of dollars being poured into these really downstream issues, why is the needle not moving? And I would offer that I think it's because we're failing to take that systems level approach. So much of our programmatic response is designed specifically to meet a very narrow downstream outcome, as opposed to allocating dollars and interventions on more upstream issues like food production, and really looking at how local producers are supported in starting and sustaining businesses. And I could talk all day about local food production, so maybe I'll pause to see who else wants to jump in here.
Yeah, I am really happy that we touched on this, because the other benefit that we have at Eskenazi is that from our inception we have cooked our own food, and that has made a lot of things possible in terms of commitment to nutrition. And Seth Grant, who is here and runs our food nutrition services, has led our focus on local procurement. And so we use the term closed loop, and I was so thrilled that both in the USDA conference and in the White House summit there was this focus on local production. So how that plays out is that patients within our hospital, visitors to our retail sites within Eskenazi. The food that they're eating is over 70% sourced locally. And when we think about what that enables during the pandemic, when retail went down and all of a sudden there was food that was going to be plowed under, the farmers are calling Seth and saying, can you take a bunch of, name it. So I think that's the thing. And there's, there's the health benefit, there's the economic, when we talk about all this, the root of all this driving back to poverty, that isn't just here in Marion County, that's across the state, that's in the rural areas as well. So it's the sort of thing that really creates a close loop, a whole systems approach that benefits everyone from the individual patient up to the growers, just as you said so well.
And I would like to acknowledge how much the state has done over the last 2 years to bridge the gap. Our local Indianapolis Community Food Access Coalition has, over the past 2 years, been able to work with the state in a way that the city and the state have never been able to do before, with funding specifically to get our local BIPOC growers, so Black and Indigenous people of color, our Black urban farmers to produce more, to grow more, and then to get that produce directly into those underserved communities, into smaller local grocery stores and other establishments. And that is something that we've been able to grow over time to the point now where we just last month were able to announce in partnership with the Partnership for Healthier America that the mayor's office and all of our partners in the coalition are undertaking this commitment to double the consumption of produce in Marion County by 2030. And this is something that we're only able to do because of this work, because of the collaboration that we've been able to have, and the ongoing planning and processes that we can put in place to create not just a program, but a lifestyle and a healthier choice for our residents.
Yeah, someone mentioned innovation, and certainly innovation and entrepreneurship are words we hear a lot in Indiana. Are there food entrepreneurs out there doing things that can impact what we're talking about here today? Any examples?
Yes,
Okay,
there are.
good.
Certainly. So one thing, and I'll admit that I'm a novice to this space as well. I'm learning a lot. One program that I do want to mention, because I think it illustrates everything we've been talking about, our team is overseeing a program, a partnership with USDA called the Local Food Purchase Assistance Cooperative Agreement, or LFPA. Malele is a partner in that, as is Gleaners. So a lot of collaboration in this space. But this program is designed to specifically make purchases of locally grown food from socially disadvantaged farmers and producers, and we are specifically in Indiana focusing on BIPOC growers. And then distribute that food in a way that is innovative, in a way that is sort of filling the gaps that our traditional food distribution networks might be missing for whatever reason. But it really is sort of amplifying the perspective of local communities to define what food and where they would like it to be distributed. And the sort of the underlying through line for this program is that really at the end of the day, it's about creating meaningful economic development opportunities for socially disadvantaged farmers in our state. And this speaks to a larger challenge, and I'll kind of come back to your question, but one of the biggest challenges I see in this work is that we largely are very beholden to whatever funding stream we happen to be working within, right? This program, LFPA, is a USDA program, so there's the allowable versus unallowable costs are very specific and also somewhat nonsensical, right? Like it's a program that's created to provide economic opportunities for BIPOC growers, but they're not allowed to use any of the money for production inputs. So they can't use any money for farm supplies or seeds or machinery. It makes sense from the funder standpoint. There's other sort of grants out there to get at that kind of thing. But from a programmatic implementation standpoint, it's very, very challenging because the people that we're working with and trying to build trust with, there's a deep skepticism about these sort of federal level funding types of opportunities. So what we're really trying to do is get really creative with the way we fund programs. So push the limits to the extent that we can with whatever funding stream we're utilizing. And what kind of non-traditional partners can we bring to the table to really sort of intentionally and strategically fill those funding gaps to ensure that we're meeting people where they are. And so to answer your question, what I've learned about this LFPA process is that there are really innovative examples of the way that people are already doing this on the ground throughout the state. There's a group in Bloomington based out of Monroe County called the People's Cooperative Market. And they essentially do almost, it's a cooperative of local BIPOC growers that do everything on a sliding scale. So they don't have a price point for anything. They really they've designed and they're solvent, they're working because the people in their community are really bought in. It's a really community-driven approach that's driven by the eaters in their community and sort of that co-directional mentality where the community is all bringing what they have to offer to the table to move the needle forward.
Yep.
It had never occurred to me until this moment to think of our folks as food entrepreneurs. But I think dovetailing on what you said, what Seth and Amy Carter, who runs our clinical nutrition, and the whole team are creating is really helping tie all this together. So recognizing the need, after first illuminated by just the overwhelming need of the Crooked Creek food pantry, and then what we learned by embedding screening through all of our primary care sites and seeing the volume of individuals who are food insecure, including our own people who work at Eskenazi Health and our visitors. Seth and his team started a Fresh For You market on campus and testing a model of whether low-cost retail to those who can provide, who can pay for food, can help support free food for those who can't. So that extended to a voucher program that is supported by Cummins and Kroger, the Value School of Medicine, many others who are helping to support the vouchers to get to sort of seed. So we screen, individuals are identified as food insecure. We work to get them enrolled in SNAP with now outreach coordinators we've hired specifically for that purpose, get vouchers to the market that, again, see if we can create that self-sustaining loop. And another facet of that is that we host local restaurateurs. So individuals from our neighborhoods come and prepare lunch on sort of a pop-up basis, and that the proceeds from that, from our local family-owned restaurants, help bring the resources to provide the dignified shopping experience in a pantry mode for those who need that support. And then just following on the heels of the success there, we're really excited that in the first quarter this year, with support from Indigo, who donated a bus, and then Cummins, who provided the resources to help us convert that bus into a market and retail food restaurant on the go. We'll have the Fresh For You market that will be going to neighborhoods, scheduled into neighborhoods where we have low access, different place each day, but people will know ahead of time where that bus will be. And from that, we pull everything that we've learned from our patients and our community to bear. So that we'll have certainly the food. We'll also have all the nutrition counseling. We'll have the SNAP outreach, getting people enrolled, and the vouchers for those who need immediate relief.
So I just want to piggyback on the mobile unit, because I think that yes to everything that's been said, but in addition, we need to make sure that we're getting the food actually to the end user. And so we know that there are several communities, both urban and rural communities, that simply don't have grocery stores. They have convenience stores, which don't have nutritional food, and also have higher prices. So I think when we take a system look at things, we need to figure out how we get more opportunities to buy food in the neighborhoods, whether it is mobile units, whether it is more grocery stores, whether it's food stands, whether it's actual local people in the neighborhood who are growing things, or whether it's transportation to another location. So one thing that we do as a managed care entity is that we have a food transportation benefit. So our members can get a ride to the local grocery store, which might be 30 minutes away. So I think we have to begin to think outside the box. And I think as we're having these public health conversations as a state, we really need to look at our public transportation system, which is woefully inadequate if we compare it to other major metropolitan areas. And if we could somehow improve public transportation and opportunities to get to places that may be a little bit further, then we can really, again, put the food into the hands of the people who need it.
I want to get to some questions from the audience. Have some great questions that have been submitted. Talking about partnerships, what are ways that university and research partners can work with community partners to make wider impact in terms of reach, sustainability, and funding of anti-hunger initiatives? And if there's any data, that would be helpful as well. Anybody want to tackle that one?
If you want to start, I can.
No,
Sure.
you go ahead.
Just a brief from me. I do think that there's some great research that's going on. There's some research from the researchers from the IU Food Institute that have actually been really looking at SNAP utilization in Marion County. That's going to be published pretty soon, which I think will be really illuminating for all the work that we do. I also think that from a high-level research perspective, what we really need more of is community-based participatory research. We need researchers to understand that, really at the end of the day, the audience for the research should not be other researchers, right? It should be the communities that we are hoping to serve. And I think sort of maybe the theme here, that work can and should happen at the speed of trust. So, right, that's about identifying and partnering with trusted community leaders, not only to the ends of producing reliable outputs from research, but at every process point throughout the way. Equity. We say a lot in our work that equity is not only an outcome; it's both a process and a practice as well. And I think that is just as relevant, perhaps even more important to think about from the research standpoint.
Good. Another partner question, if you will. What is the best way for local nonprofits, and I know there are a number of nonprofits represented here this morning, the best way for nonprofits to partner with local government agencies to serve food insecure families?
Government.
I would say the best way to partner starts in community and for community. And everything that we have talked about, whether it's research or innovation, at the community level, those residents, those grassroots organizations, they're the ones that know what they need. And so starting with community, bringing community into the table, and then coming along with service organizations, other public institutions to find solutions is the best way to ensure that we're not just providing for anyone that can align with our services or our goals, but for everyone that needs assistance.
I'd like to actually go back to the research too on a couple of points. You mentioned how do we help people make different choices? How do we learn? How do we learn how to make the right choice, the choice that people embrace? And so we've had individuals within our system who for a couple of decades have been very deliberately working in our neighborhoods, in our health centers, working, just informing the programs. And that's published, but you're right, a lot of that is read by other researchers. So I also want to call out the Purdue Center for Health Equity. So sometimes when you want to really get granular and pin down what is possible and understand what specifically what we need to do to be effective, you have to drill down a little bit beyond the global. And so that's a partnership that is a program that's actually focusing on individuals with diabetes and cardiovascular disease, starting with only 75 individuals, but extending the benefits that Dr. Kane has created, the incentives for fresh food vouchers, the nutritional education that is part of everything we do, bringing all that to bear and then measuring all the hard clinical outcomes in just 75 individuals to see, to get a better understanding of what works and what more we need to do.
Another question from the audience. We're talking about healthy food. The primary root cause of hunger is people can't afford food. With healthy food can be more expensive. How can we change the diet of food insecure families?
So I think that goes back to number one, helping to offset some of that cost. So I think if we can procure the healthy food locally through local farmers, obviously we can drive that cost down. I think that there are opportunities for subsidies from the government or community-based organizations to help drive that cost down. But I think, again, there's a place for education as well. So needing to not just make it more affordable, but again, really finding ways to resonate with families to help them understand what the best choices are, and why we really want to make this particular food more accessible than another food.
Mm-hmm. Good.
One more thought about that. In our work, we're trying to pivot a little bit away from using the word healthy to describe food and use the word nourishing instead. Mainly because specifically in the nutrition education space, what we really know about behavior change is that shame and fear tactics are not motivators for behavior change. And oftentimes unintentionally framing foods in this oppositional way of this food is good and this food is bad really has that effect of shaming the choices that people make. I myself, who have a lot of education around nutrition education and I have no issues with access, I often choose to eat unhealthy things. Just last night, I had a little preview of some Halloween candy that I was cabinet. So it's actually a really interesting dynamic in a space where I think some really innovative research should be done. But we actually don't, as a field, understand very much about food choice. Even people who do not lack access, who have all their toolboxes are totally full in terms of nutrition education, often still make choices that we would not put in the bucket of healthy, right? In my previous role with the American Heart Association, I did a lot of advocacy work around healthy food financing initiatives, and was often a little maddening. I will just share that I could never find any research to support this assertion that we were making, that if more affordable healthy retail options were available, people would make better food choices. The research actually does not bear that out at all. So what I'm getting at is that it's about sort of conceptualizing food more holistically, because oftentimes the nourishment that people need from food in a given moment or given life circumstances is not about what their body needs for health. And as long as those choices are paired with a holistic understanding across the lifespan about balancing your choices, that's really what we hope to see at the individual level. I really, at the end of the day, I don't really care too much about micromanaging individuals every time they want to make a choice between one food or another. To me, what it's more about is having that broad spectrum of choices to make. At the end of the day, to me, that's justice. That's food justice.
We have a program of lifestyle medicine within our primary care sites, and I loved your reference to the nourishing body versus soul, and I've conducted some of those group visits, the sessions, and we don't get very far around the table, maybe the second person before the Kleenex comes out, and people are describing the childhood trauma you've referenced, and so I think that's another. We as foundational as everything we're talking about here in terms of nutrition is the mental health, and that's a topic for a whole other day, but it's something that we all recognize as critical, and I think that is that is something that may be even more foundational to the goals that we're trying to achieve in terms of health, eating behaviors that promote health.
And that's something we haven't touched on is mental health, because we know that hunger has a detrimental effect on mental health. We joke a lot about being hangry, but what if you felt that way all the time? You know, what if you were a child and you had to go to school and you were expected to perform and to learn, but yet you haven't had enough to eat? And so we know that hunger leads to cognitive disabilities. We also know it leads to anxiety, to anger, to aggression, and to depression. And so likewise, I think that proper nourishing food certainly can improve the mental health of our community.
We are up against time, but I do want to give anyone who would like to jump on this very quickly. The awareness issue is huge, obviously. I know in doing prep work for this, I learned some things I didn't know about food insecurity. And are there things that we all can do to help that whole awareness issue? Folks in the audience, as they leave today, can, just from an awareness issue in their particular with their particular constituencies or communities, can do to help in that regard?
I think this is a place where social media can be positive. There's a lot of things that aren't positive on social media, but I think sharing some of the statistics and some of the conversation that we had today with your followers and your family and your friends can really help raise awareness, perhaps generate donations to Gleaners and to other food banks, and just let people know that this is an issue, and that if you have an opportunity to unite forces with a community organization or a academic center in some way to help increase food security, to do so.
Very good. Dr. Harris, I'll let you wrap things up.
Yeah, I was assigned this task, I think, as a newly elected board member at Gleaners, to really thank, and I'm going to first thank Gleaners and the IBJ for hosting this year after year. This is nothing new. You've been really committed to this work for the long haul. And I want to thank my fellow panelists. As always, I've learned a lot, and I've got some ideas about things we can talk about later. Mostly, though, I want to thank all of you for your presence here this morning. It takes an effort to come, get up bright and early on a Monday morning and show up. But you're here, and what's even more important than your presence here is the work every single one of you are doing in the community. And I know most of you, and I will say, I'll just end by what's keeping me up. I'm ever the optimist, and hope springs. And when I see, when we've heard some of the statistics, we certainly know there's a lot more work to do, but there are some really hopeful things going on. We are developing critical mass. There's a recognition of the central importance of food. There's a recognition that not all food's created equal. Healthcare systems across the country are getting engaged in this work, that upstream work. So there really is a lot that we can be excited about, and you all own that, and we're really grateful for what you do in the interest of the community that we all care about deeply.
Very good. Thank you, panel. Thank you very much. Thank you all for coming. Have a great day.